Hey everybody, welcome to week 2 of the NCHV Virtual Annual Conference. We're so excited to see all of you. I'm thankful that you've chosen to spend time and energy and effort with us for the last week and for this week. This week we're going to focus in on groups that have special needs when it comes to housing, shelter, and everything else. We're also going to focus in on local innovations that will help make your projects and your programs more veteran-centric. Last week, we talked a little bit about affordable housing, employment, benefits, income, and all of the things that you should be thinking about connecting your veterans to as they move on from your programs. You also heard from our NCHV founders about the ways that NCHV was founded and some of their thought process around keeping veterans from being left behind. As military veterans, I know many of you are military veterans, and I'm sure you can relate to the idea that nobody should be left behind. Regardless, we don't leave people behind on the battlefield, and we certainly don't leave them behind unsheltered on the streets. We talked last week specifically about Black veterans and some of the inequities that we see in that population when it comes to racial inequities. But this week we want to focus in on another group, and that's transgender veterans. We do have a couple of facts that we know that we'd like to share with you, right? We know that 1 in 5 transgender veterans faces housing instability, and that's terrible. We also know that 1 in 4 transgender veterans avoid shelter for fear of mistreatment. And we know that this population in particular, while being a small population, is 3 times more likely than the general veteran population to experience homelessness. And we can't keep leaving this population behind at this rate. That's unacceptable. So one of the things that we want to highlight for you is that VHA does have a directive that says that healthcare providers should serve vets in accordance with their self-identified gender. And we think you should too. I'm urging each of you to do the same in your program and in your community. In 2016, HUD pushed out the Equal Access Rule, which was basically a regulation that allowed providers to serve veterans or serve people, not just veterans, right? People and veterans in the manner in which they request service without any additional verification, no questions. And this year, HUD has pushed to change that policy, basically allowing providers to deny someone access to shelter or permanent supportive housing or what have you based on a good faith determination, which is a little bit ambiguous and is likely able to be made by a frontline staff member as long as a referral is made to another shelter. There are some pretty big challenges with this proposed regulation. I mean, first of all, it rolls back a prohibition on gender-based discrimination against transgender people, which I personally think is wrong, and I hope you do too. Amidst the pandemic, the last thing that we need, quite frankly, is to be turning people away from shelter and services, given the health risks that they'll face and the likelihood that they face of violence when they're out on the streets. So we need your help, each of you. We need you to go and let HUD know that we won't stand for leaving anybody behind. So if you agree that this is wrong, I'm urging you to go to housingsaveslives.org right now. I'll let you click away from the screen. I don't care. I'll be here when you come back. But please go and file an individual comment saying that you don't believe that we should be leaving people behind. If you're someone who leaves an organization, I hope that you'll also submit one on behalf of your organization because the deadline to comment is tomorrow. I've got a last few couple of words, and these are really for GPD providers and folks who are operating congregate transitional housing. The first thing I want to let you know is that I'm really proud of the way that all of you have quickly pivoted in the midst of COVID to maintain client and staff safety in your organization. Your services are critical and they're needed now more than ever. One of the things that you all know now is that NCHV's got a toll-free hotline where we talk on a daily basis to veterans who are in a housing crisis and are looking for services, care, shelter, housing, what have you. And the changes that we've seen due to COVID have led to some veterans calling in looking for clinical services and shelter, but not being able to access them because the decreased census in some of these programs has narrowed the options that are available to them. So I want you to know that even though you're seeing a lot of changes, you're still a really critical part of the system of care for veterans. And we want to acknowledge that. One of the things that we're realizing is that COVID seems to be here to stay, at least for a little bit. And so some of the lessons that we've learned as we've adjusted to our new normal of masks and sanitation and isolation and less people in places together at the same time, those lessons will probably still be here to stay. And so this quick pivot hasn't been easy, but one of the things that we're thankful for is that the financial impacts of some of these pivots have been somewhat blunted by the increase in per diem. But I think that there are still some more permanent changes that will be required to the way that facilities are configured in order to enhance safety and decrease the amount of congregate space that you've got where people are gathering on a regular basis. I know for you providers, especially in the GPD program, the last few years have been full of change. You've been subject to reapplications, which I think have been a pretty good thing. You've changed your service models, which have also been a good thing because they've allowed you to fit better into the community that you're in and have allowed you to narrow your services to specific populations. One of the things I think about in times like this is a quote that is commonly attributed to Lao Tzu. He said that new beginnings are often disguised as painful endings. And so I'm hoping that as you all go through the hard work and the process of rethinking what your organization could or should look like and what you could and should bring to the veterans in your community, I want all of you to keep new beginnings in mind. I know that some of you who are on the GPD operational call this month heard that the program is considering issuing a capital grant to decrease the congregate nature of some facilities. And in order to support this essential safety measure, NCHV has been doing some work with Congress. And one of the things that we've been asking for is that they reduce the recapture and recovery burdens that you'd be held to if you took that grant. We're also working to decrease the match requirement, and I know that the GPD office is probably having some of those same conversations right now. Our goal is that we decrease the barriers discouraging you from seizing this opportunity for good and seizing this opportunity to improve what you do for veterans in your community. So my charge to each of you is to start thinking about your new beginnings. What kind of renovation, additions, modifications, etc., would be required to help you safely serve veterans in your community without undue facility access restrictions? Now is the time for each of you to think about enduring change rather than quick fixes. We're going to pivot this opening session a little bit, and we're going to focus on giving out some awards, because normally we give out a ton of awards at our conference, and we're going to do a little bit of that. So I'm going to do the first one, and what we want to do is highlight today some of our outstanding board of directors. So an organization, you all know, well, those of you who work in nonprofits at least know that an organization is nothing without a solid board of directors behind it. And at least from my perspective, I'm really proud of the depth of expertise and knowledge that the NCHV board of directors has. I've been blessed to work with them and to learn from them and to collaborate with them and draw on their knowledge as we continue to operate in the world. And this year, I'm awarding Meritorious Service Awards to 3 former board members, Leon Winston, Robert Norris, and Brad Bridwell. Leon recently retired as the Chief Operating Officer of Swords to Plowshares in San Francisco, where he did many things, including developing deeply affordable housing in a high cost market. Mr. Norris recently retired from the Fort Ord Reuse Authority, where he was a principal analyst and managed the BRAC process and worked a lot with some of the shelter providers and other organizations that were still there on site. Brad Bridwell, is the Director of National Operations at Cloudbreak Communities and manages a portfolio of permanent supportive housing developments across the country. And I'm so thankful for all of them and the greatness that they brought to our board and the abilities and challenges that they've helped us work through as an organization internally. Cindy is going to go next, and she is going to give out another Meritorious Service Award.
Thank you, Kathryn, and welcome back, I guess, everyone, this afternoon. It's great to see you all again. I have the pleasure of giving out the Meritorious Service Award to Yolanda Suarez from AGIF and VOP, the American GI Forum National Veterans Outreach Program. Yolanda has been at AGIF for over 4 decades and very committed to this work. And up until very recently, she was a senior vice president. As you may remember from last week's opening session, when we did a memorial to Carlos Martinez, Carlos lost his battle with COVID in early August, and Yolanda suddenly found herself without the friend, the mentor, the coworker, the inspiration that she had worked with for almost 42 years. In the midst of that sort of, really devastating organizational loss, Yolanda was appointed as interim president and CEO of AGIF, but she was also processing this personal loss. And she continues to work in Carlos's memory and in his legacy, but also supporting the team that is there, really struggling with that loss every day. So it's my pleasure to give this award to Yolanda, really in honor of the 40 years of dedication she's shown to this work, but also her continued commitment under really the most trying of circumstances to honor Carlos's legacy and, most importantly, to continue servicing the veterans that need it. So congratulations, Yolanda. And next, we are going to look at a short video for another one of our awardees.
Good afternoon. My name is David Higgins. I'm the Communications Associate at NCHV. Media has been and continues to be an important tool used by NCHV to inform, educate, and create awareness for our shared mission to end veteran homelessness. Whether traditional or online, the media can impact millions to spur change or create chaos. In times like these, where messages can be co-opted or corrupted, it's great to have partners that speak the truth in an unbiased fashion. Stars and Stripes provides independent news and information to the U.S. military community, including active duty service members, DoD civilians, veterans, contractors, and their families. The first Stars and Stripes rolled off the presses on November 9, 1861 in Bloomfield, Missouri, and since then they have grown into a multimedia organization. Their coverage of critical issues for the military community in an independent, non-biased manner is a shining example for all media outlets. They played an integral part in alerting the public to the needs of veterans experiencing homelessness in the early days of the pandemic. Their articles, reports, and tweets were undoubtedly instrumental in getting our federal partners and Congress to acknowledge the severity of the threat that COVID-19 posed and to act to neutralize that threat. Their work has saved lives. For their work in covering veterans issues, NCHV is proud to award Stars and Stripes with a Meritorious Service Award. Thank you for all you do for the veteran community.
Thank you, David. And for those of you who are listening through the phone, you may not have been able to hear the audio on that video for honoring Stars and Stripes. But it is in the computer. Those of you who are listening through the computer were able to hear it, and it will be in the recorded version. So if you weren't able to hear the audio on that one, we apologize, but it will be available in the recorded version. I'm going to hand things back over to Kathryn for our next award.
So our next award is the Federal Partner Award, and it's an award that we give to someone who works for the federal government and provides outstanding service and outstanding coordination and quality of care to veterans. And this year, we're giving that award to John Kuhn of VA's SSVF program. One of the things that has been critical in this time during the pandemic is the quick shift that a lot of organizations and a lot of federal programs have had to make in order to ensure that people and veterans experiencing homelessness have adequate access to safe places to isolate, that they're able to access housing. And I think John has really been the epitome of innovative change in a quick way. And the ways that he's shifted his program have allowed communities across this country to serve veterans in a much more cohesive way. So, John, it's with pleasure that we award you the Federal Partner Award this year. Thank you so much for all that you and your team do for veterans across the country. We so appreciate you. Our next award will be given by our award-winning operations manager, Karen Christian. Monet. It's okay, come on, I'm done with that one.
Okay, it looks like we're having some audio issues with.
Hi, we're going to try this one more time, okay? My name is
Yes, go
Karen
ahead.
Christian. Thank you, Cindy. My name is Karen Christian. I am the Operations Manager for the National Coalition for Homeless Veterans. NCHV is proud of our coalition of organizations that collectively join resources to produce a focused change and targeted outcomes that otherwise would be difficult or unable to deliver as individuals or separate organizations. The power of NCHV is you. I am honored to present the 2020 Outstanding Member Award. This award is given to an organization that has demonstrated leadership in coalition building. This year's awardee is Black Veterans for Social Justice in Brooklyn, New York. Under the leadership of Army veteran Wendy McClinton, who served during the Desert Storm Persian Gulf era, BVSJ has evolved into a community fixture in Brooklyn, New York. Founded in 1979, BVSJ over the last 41 years has not only served proudly thousands of veterans, individuals, and families in the community, but also those in all 5 boroughs of New York City. Currently, BVSJ operates multiple shelter facilities, providing housing to men, women, and families, 3 of which were open during COVID. BVSJ provides access to resources that assist with resolving complex problems that have historically limited veterans from being contributing members to their families, communities, and society. Wendy McClinton and her team are always only a phone call away, whether it be questions on programming during COVID, services for veterans in their area, or modeling their best practices and allowing NCHV to share them. For their work in continued coalition building, NCHV is proud to award BVSJ the 2020 Outstanding Member Award. BVSJ, thank you so much for all you do for the homeless veteran population in the community, always with tender, loving care and a listening ear. Congratulations, BVSJ. Thank you.
All right. So that is it for awards. We are going to pivot now to our next segment, which is our federal partners panel. And this, at least for the in-person conference, has always been my favorite part of the conference, because this is the part of the conference where we allow all of you as program operators, local staff in the community, engaged partners, to ask questions of the leaders of the federal programs that we work most closely with. And it allows you to learn what's happening and what they've got going on in their neck of the woods. So we've got three of our closest federal partners here with us today. We are joined by Dr. Keith Harris from the Department of Veterans Affairs, Norm Suchar from the Department of Housing and Urban Development, and Maria Temikel from the Department of Labor, Veterans Employment and Training Service. So Dr. Harris, I'll tell you just a little bit more about them, and then we'll sort of give them a few minutes to introduce themselves, and we'll open up to question and answer. So Dr. Harris is a clinical psychologist, and he is the National Director of Clinical Operations for VA's Homeless Programs Office. He's been a resource to me and our team and has done wonderful work across the VA Homeless Programs Continuum, allowing them to measure performance, do statistical modeling, and support operational planning. Mr. Suchar, Norm, is the director of the Office of Special Needs Assistance Programs at HUD, and he serves as the director of those programs, which supports the $2 billion COC grants across the country. Maria Temikel from the Department of Labor is the director for grants and training at DOL Vets and has been responsible for managing the grant programs and the NVTI in Dallas, Texas. I'm going to turn it over first to Dr. Harris to share a little bit about what's going on at VA, and then we'll just run through the panel and we'll start to field questions and answers. So as you, the audience, are listening to what they're saying, please start to think about what questions you want to ask and what you want to know about what's coming around the pike. Thank you, Dr. Harris, for joining us today. It's good to see you.
It is my pleasure, and I'm glad you could see me. That took me a little while this morning to get set up and get this all working. Can you hear me also? Let me just confirm both. Okay, good. So hi, everybody. I'm happy to be here. And we've been asked to provide some program updates both on during the COVID time, the COVID emergency, but also post-COVID. So what I'd like to do is cover some general information about VA homeless programs in both of those categories first, and then with the time I have left, I have a couple program-specific updates I'd like to provide also. And one of the things I want to say right off the bat is I think this question of what post-COVID will look like is a really interesting one and is impossible to know. I don't think anybody anywhere knows what the post-COVID world is going to look like. And so part of it, of course, is doing our best to anticipate that and project the needs, project the conditions we'll be facing. But part of it is actually assessing what we've already changed and realized works better than what we were doing before. And there are things in that category that I'll touch on as well. And along with that, one of the things that this period has forced us to do in VA homeless programs is be more flexible, more creative, more innovative than we've ever been before. And that's true both at the VACO kind of policy, program policy level, but also true at the field level, field operations level. And that's certainly something that we want to adopt going forward. It's a really quite an exciting shift for us and for our programs, I think. In terms of during COVID, there's been a couple things we've focused on most critically. The first, without question, is responding to the emergency itself. And in that case, it means getting unsheltered homeless veterans off the streets into safe and stable housing, where we can reduce both the risk of infection to that veteran, but also reduce the risk of spread in the community. Both those things are important, and we take both those pieces seriously. All of our programs are focused on doing that in their own specific ways. And some of that's through hotel placements, of which SSVF has certainly led the way in terms of the numbers on that, but also through reconfiguring congregate settings, which we've seen both in our grant per diem programs and in our HCHV contract programs, or finding solutions that help veterans continue the kinds of processes that are required to find and move in to a place, whether that's workarounds around PHA shutdowns or slowdowns, inspection slowdowns, things like that. So that's been the biggest thing. Let's get people, unsheltered veterans, off the streets into a safe and stable place where they can socially isolate. Another big priority for us has been testing. We released a memo recently regarding testing in the congregate settings in GPD and HCHV sites. Those of you who are providers, I'm sure, are aware of that now, and really appreciate everyone's efforts to work on that. Testing is complicated for a million reasons that 6 to 8 minutes of a talk won't allow me to get into, but we really appreciate people working with that and taking that seriously. A third general level that all of our programs have focused on is telehealth. It's the shift, really a giant shift for us in terms of our healthcare and service model, moving from a face-to-face model to a virtual one. All of our programs are making their own specific adjustments to that, which I'll talk about a little bit in a second, but that's both taken the form of making sure devices get into the right hands, get into the hands of veterans who need them and the staff who need them. You've got to have the equipment to do that kind of work, but also then developing a service model that works, that still has the same level of connection and service intensity that's required. A couple other areas we've been focused on a general level. A big one is funding. We can't, and you can't, those of you who are service providers, ramp up services and adjust and adapt services as needed without money. And so that's been a big part of our focus with Congress, within VA, getting our share of CARES funding so that we can push it out to the field and get that dedicated to services for veterans. And along those lines, we've worked extensively over the past 6 months with Congress. We've had 7, I think at last count, 7 briefings to either the House or Senate Veterans Affairs committees on either the appropriator or authorizer sides. We've also done extensive technical assistance with the staffers on those committees related to legislative flexibilities. Both the House and Senate Veterans Affairs committees came to us early on in the pandemic asking what kinds of flexibility we needed to fully respond to the emergency. And they crafted a law to allow VA the types of flexibilities we need. If I have time at the very end here, which I'm already guessing I won't, I was going to get into more specifics about that. But if there are questions, a law has been introduced in Congress. It's awaiting a vote that'll provide VA the ability to directly provide with appropriated funding many of the things that we can't at this point. Things like shelter, food, transportation, supplies, things like that. I can talk more about that in the Q&A period if there are questions. And finally, and though this isn't directly related to the pandemic, like the rest of the country, we are engaged in the national reckoning around race and racial equity. And the way, one of several ways we're doing that is continuing to monitor data closely on veterans of color and their rates of entry into our programs. We want to look at accessibility, make sure our programs and services are accessible in an equitable fashion, and also looking at the outcomes. We want to make sure that veterans of color are benefiting from our programs in an equitable fashion. And we have, our office has created a work group that's working on a variety of things that our office and our programs can do around racial equity as well. So again, it's not directly COVID related, but unfortunately, as we've all seen in the news, there is a COVID tie-in, and it's something we take very seriously. With my remaining couple minutes, I want to touch on just a couple program-specific updates. And it's funny, I didn't know John was winning that award, but I had written into my prep notes that no program had been more responsive and flexible during COVID than SSVF. And that is, of course, a testament to John and his staff, both at VACO and the grantees around the country. Well-deserved award. So John, if you're listening, congratulations. And SSVF has really been remarkable during this period through a combination of its own flexibility, through the use of the Stafford Act. They have made broad policy changes, lifting limits on eligibility and duration of services, both general services, but also in terms of hotel placements, lifting caps on prevention, lifting limits on food assistance. There's a million things SSVF has done, and they have been crucial in our ability to assist homeless veterans during this time. The other thing that SSVF has really been an important partner in is around collaboration with other programs, and especially Hudvash. A great example of the ways our programs have worked together is that, as you know, a lot of PHAs shut down or slowed their processes considerably, especially early in the pandemic. And we had veteran voucher holders who couldn't move into an apartment because or maybe not voucher holders, maybe they'd been referred to the PHA and waiting for a voucher. SSVF stepped in and paid the rent for those veterans, allowed veterans to identify a unit and move into that unit while awaiting all of those steps that were on hold due to COVID-related shutdown. So it's a really important piece of collaboration and just one of many examples of it. In Hudvash, the biggest focus is really on shifting a face-to-face model to virtual. We have seen an over 6,000% increase in the number of video telehealth visits since January. So it's a giant shift in that program. And I know there's those of you out there have raised this concern with us. We have it also. Veteran voucher holders in apartments are experiencing some extreme forms of isolation and may not have the kind of social network that many of us take for granted, may not have the digital equipment that many of us take for granted to remain in contact both with their care providers, but also the rest of the world, whether it's friends, whether it's family, potential or prospective employers, et cetera. So we focused a lot in that program on building out our virtual care model. We've also focused a lot on getting digital equipment into the hands of those veterans in particular and the staff in that program. I have just a couple other things, and it looks like I'm already at 9 minutes, Kathryn, so I'm sorry. I just want to touch on grant and per diem and then 2 quick comments about justice and employment. Grant and per diem, as many of you probably know, the initial CARES Act lifted limits both on funding and on per diem rates, which was a big and important piece of our ability and your ability to respond. At last count, almost 450 grantees had been approved for per diem rate increases. We're really happy to see that and hope we continue to see more. And Kathryn, you noted in your intro earlier about the possibility of a capital grant, which is something we are in fact pursuing and pretty excited about, designed to help grantees develop individualized spaces to facilitate social distancing, quarantine options, et cetera. I want to end with 2 quick updates, one on our justice program, one on employment programs. As many of you probably know, most jails and prisons remain closed to in-person visits. And so that's a huge part of our justice programs, is going into these settings and meeting with veterans who have a pending release. So we used care funding to purchase and distribute almost 1,000 iPads that Veteran Justice Program staff will place in the jails and prisons so that veterans there can use them and stay in contact with their providers. And finally, employment. Obviously, there was massive unemployment earlier in the pandemic, especially. We have maintained focus on those veterans who are seeking employment, providing virtual services, virtual job fairs, continuing to assist with resume development. And then we've also continued to partner with our other federal partners, one of whom is here on the panel with me. We have a joint webinar planned with HVRP grantees next week. And Maria, it was shared with me that DOL has really been a very good partner to VA during this time, very both responsive and supportive. So I wanted to thank you personally for that. Kathryn, I think in the interest of time, I'll stop there. I didn't say a whole lot about the post-COVID world. I guess the last thing I will say about that is, as I noted at the beginning, we're really focused on what elements that we've adapted, innovated, made more flexible can we retain going forward, and what about our virtual model of care can and should we retain as we layer back on the personal and face-to-face care. Those are the big things we're focused on right now, and we'll continue to build out. I think I will stop there and wait for Q&A. Thank you.
Got it. Thanks, Keith. Norm, you're up. Let's hear what's going on at HUD. What do you got?
Thank you so much, Kathryn, and want to echo a lot of Keith's comments, and especially congratulations for John and all your other awardees. Just some impressive work going on out there. So I want to give some updates about what we're doing at HUD, especially around homelessness. The first thing I want to update everyone on, I think everyone knows that we received a fairly large appropriation from Congress, about $4 billion for the Emergency Solutions Grants Program. This is a program that provides emergency shelter, rapid rehousing, homelessness prevention, and a variety of street outreach, a variety of other activities. So this is normally a program that's about $250, $300 million a year. So $4 billion is a dramatic increase for that. And so we've been working on getting money out to jurisdictions to utilize that and helping them set up their programs. We just published a notice on September 1st that describes some of the additional activities you can use that for. One of the main ones being that we have a new category called temporary emergency shelter, which is slightly different from emergency shelter in that it doesn't have to meet a lot of the sort of habitability requirements and sort of the structural requirements if that is necessary to respond to COVID. So we know that in a public health emergency, sometimes you just have to get things done very quickly. And as long as you have public health officials determining that it is needed and beneficial and such, then you'll be able to use Emergency Solutions Grants money to set those up. In addition to that, HUD received $5 billion for the Community Development Block Grant Program. This can fund a lot of similar things to ESG. It can help with shelters. It can help fund rental assistance and also with some infrastructure and other kinds of activities. In addition to that, we received funding to provide a lot of technical assistance to communities. So we're working directly with a lot of the places where COVID hit hardest. So some of the larger cities and also some smaller places, but places that had pretty big outbreaks. And the goals there are both to promote public health in the emergency shelter system and in encampments and other unsheltered locations, and to try to prevent the spread of COVID in the homelessness population. In addition to that, we're very focused on helping communities ramp up rehousing activities. Keith talked about this a little, but the one thing we absolutely know about the spread of COVID is the safest place for people to be is in housing, and congregate settings especially, but even unsheltered locations are just not good for people. And both it sort of reduces their underlying level of health, which makes them more susceptible to bad outcomes if they contract COVID, and it also just makes it easier to catch COVID. So we're working very closely with communities, trying to help them stand up rapid rehousing or other kinds of housing programs to help them move people out of congregate settings and into their own units. One part of that is non-congregate sheltering. So we've been working with FEMA, and I know in many of your communities you've seen hotels, dorms, and other sort of other SROs and other kinds of similar settings used to help people who were in crowded shelters where they had to depopulate, or in encampments, or at such severe risk of COVID that they needed sort of an isolated place to stay. So we've been working with FEMA and others to make sure that those are effectively stood up, and also that once those are going to be wound down, we don't know when that'll be, but once we start winding those down, that people aren't returning to the streets or to unsafe congregate shelter locations. So as I mentioned, the safest place for people is in housing, and we have been really creating a lot of resources and working with communities on developing rehousing strategies, working with public housing authorities, providing rental assistance, recruiting landlords, all those things. Those of you who run SSVF programs, those will all sound very familiar. In addition to that, we're really, as Keith mentioned, VA is participating in the work on racial equity. We at HUD are as well, and trying to help communities understand how to use CARES Act funding in a way that promotes racial equity, and within their continuums of care, within their homelessness planning and execution, that they are bringing in Black and Indigenous and other people of color into the planning process, into the execution process, looking at data, making sure that they're promoting racial equity at every step of the way. We're providing guidance to communities on how they can ensure that as they distribute funds under the CARES Act programs, that they are identifying organizations that have expertise in racial equity and ensuring that they are participating in the execution of these programs. So that's been a core value from the very beginning of our COVID work. In addition, we have been doing regular office hours and other webinars around different aspects of COVID response and rehousing. So we have office hours. It's a webinar every Friday, runs from 2:30 to about 3:30 Eastern Time. And we just cover a variety of topics. VA has been participating in those webinars and others as well. And we try to blend community examples with updates to federal programs, with updates from the Centers for Disease Control and Prevention about how COVID, their latest guidance and about how COVID is going. So we'd encourage everyone to participate in those. You can find out about those from our listserv. And if you don't know where to sign up for that, somebody in your community probably does, but you can also go to hudexchange.info, and that's hudexchange, all one word, .info. And then you can see information there. You can both see all the resources we've put out so far, and you can see information about our upcoming office hours and other webinars. A couple quick updates on things that people I think may be interested in. The Continuum of Care competition is something we generally start every summer. We've obviously held that off this year because of COVID. We are pursuing a strategy to try and simplify the process and to award funds non-competitively. We need a little help from Congress to get that done, so we're working on that aspect, and we'll have more information later. So until we get some authorizing legislation, it's hard to know exactly how this is going to go. But our goal is to try and have a process that is just non-competitive and just renews existing grants for an additional year. Several people have asked us about the point-in-time counts and what will be the upcoming guidance around point-in-time counts. We are working on that. We're trying to come up with some solutions that balance the need for safety and the need to get information to have an understanding of what is happening in the COVID world with respect to homelessness. So we will be producing some guidance on that, hopefully in the next couple weeks. But we just wanted you to be aware that we completely understand the challenges of trying to do a full unsheltered point-in-time count during COVID, and we're exploring some alternatives there. Lastly, I just want to comment on the post-COVID world and what that looks like. And I think what the COVID has really dramatically underscored are that racial equity problems are pervasive throughout society, but also throughout homelessness and our response to homelessness and who becomes homeless. And we have to really have an all of the above strategy of identifying where we intervene and try to promote racial equity in our programs. And that's in the distribution of funding, that's in thinking internally in our organizations or in our agencies, that is thinking about how we assess people, how we provide services, who's at the table, who's holding people accountable. All those things are really important. And I think COVID has just really exaggerated the need for more attention and more resources and more focus on that. In addition, I think COVID has really underscored the fact that housing is really the safest place for people to be, not just because of COVID, but for people's short, medium, and long-term health outcomes. Housing is just so important, and people do much better when they're in housing. And so our goal is to leverage the resources and the experiences during COVID to build a post-COVID homelessness system that is even better at rehousing people, preventing homelessness, and ensuring people move to stable permanent housing as quickly as possible. So thank you so much for giving me the opportunity to present here. Happy to answer any questions. And with that, I'm going to turn things back to Kathryn.
Thank Thank you, Norm. Next, we've got Maria Temikel from the Department of Labor. So Maria, why don't you tell us a little bit more about what's going on related to HVRP and veterans employment more broadly. It's good to see you.
Hi, good afternoon. And thank you, Kathryn. Thank you, NCHV, for inviting us back. Thank you again to our partners at the VA and HUD. I will have to say that I'm going to start this presentation with a little appropriations envy. I'm not sure I'm ever going to see that many zeros in my appropriation, but we do offer a lot. So, you know, those of you that know vets that understand the HVRP program, we come to the table with the employment, with the full strength of the Department of Labor and all of the services that would help veterans find jobs, get trained for jobs, keep their jobs, reach out to employers, all of those things. And so as my two counterparts have discussed, you know, we are too looking at what has changed, what has worked during this time of change. We found that our grantees were being very creative. We realized that we needed to provide support both for the grantees and helping them to design a new service delivery model, as well as to continue to operate a federal grant. We all know that in the world of federal grants, there are requirements, there are rules, there are regulations. And so we were able to implement some of the flexibilities that the administration has offered during COVID and posted our question and answers. We had a town hall listening session so we could hear directly from the grantees. But it was important for us to hear from them, to hear what were some of their challenges, but also what were they doing to be creative. And so what we see in trying to continue to support the grantees in that way is to make sure that we're collecting this information, not only from the grantees that are working, doing this well and have made this adjustment, but also from other organizations that have to provide services, that have to normally operate under a face-to-face situation, and how have they adjusted. And so we're bringing all of that together. From a funding standpoint, while it doesn't have as many zeros, we are proud of a $5 million increase for HVRP that Congress appropriated this last fiscal year. And we think that with our continued successes and our continued collaboration, we'll continue to see increases for HVRP in serving our homeless veterans. We can carve out some of that money for incarcerated or formerly incarcerated veterans, as well as female veterans and veterans with families. And so those are some of the priority areas that we are looking at to ensure that we're providing grant funds for organizations to serve those particular populations. And at the Department of Labor, the Employment and Training Administration has also seen the need to release funding. So they released grant funding earlier this spring to serve formerly incarcerated people. And of course, in our case, we want to focus in on the veterans, but the department has also then released that grant funding and awarded it this summer. And so we're looking forward to continuing to partner. And I think for us, partnership is the key. Because HVRP is so limited, we come to the table with being able to provide employment and training services. We can't do housing, we can't do healthcare. We've got great partners at the VA and HUD who do that and do it very well, but we want to come to the table with the expertise and the experience, the connections, the partnerships with the employers. Those are the things that we come to the table with. And we want to make sure that we continue to work with our grantees to partner with everyone in helping them understand what the workforce system is able to do to support. When we're looking at things after COVID, it really is going to be looking at, and I think Keith said it well, nobody knows what's going to happen. Nobody knows how this is all going to play itself out. The only thing we do know is it's going to be different. We know that that the way people are going into work, that the way work is being done is going to be different. And we here at Labor and at Vets are reaching out to employers now to understand that. We're reaching out to employers to develop the partnerships so they can understand the benefits of hiring veterans. And so that's what we're doing at our end. And so when we come up and our grantees come to the table through a COC, through directly with some community-based organizations or other local or federal partners, they know that when we get there, it is going to be about employment, it is going to be about employers, it's going to be about training and making sure that all of the good work you all are doing in getting housing and getting healthcare to our veterans, that we're right there with you in helping to be sure that they get the jobs that they need so that they can maintain that housing, so that they continue to get the healthcare that they need. And so for us, it's going to be about making sure that our participants are enrolled in other programs. So co-enrollment is going to be so important, so that when we are able to concentrate on employment, we can reach out and make sure that our veterans, our participants, are enrolled in other programs that have the support services that they need. Let's see, I'm just looking at my notes to see if I wanted to share any other specific things. One of the things that we have here at VETS also is our ability to train service providers. And so service providers are those people that would interact with the veterans in helping them begin the employment process, the employment journey, job searching. We can provide that training as well. So not only coming to a table and being able to provide employment services for veterans, we can support those service providers in helping them understand the workforce system and helping them understand providing employment services to veterans. We bring that to the table as well. We look forward in working with our partners in making sure that we continue to work collaboratively and making sure that our veteran has everything he or she needs, and making sure that they have the opportunities for training so they can get the job that is going to sustain them, that they're going to be happy with, sustain their family. And that's really where we're coming in from. So we'll be here to provide those services. A couple of changes in HVRP that I just want to bring to everyone's attention, and many of you in our world understand this, but we were able to announce the new awards this past July. So we have about 157 grants that we operate across the country, and we want to make sure that we connect with each and every one of you as well. Our grants now are a 3-year period of performance. One of the challenges we had in the past with our grants is that they would only be a base and 2 option. And so being able now to provide a full 3-year period of performance, we think is really going to give the grantees the time they need to work with our veterans to be sure they not only have the support services from our partners, but they have time to do some training. If they want training, if they need training, it isn't always just a couple of weeks. It can be a couple of months. It can actually be, 18 months. It can lead to more than a year. And with our ability to award these grants on a 3-year period of performance, we think that the grantees are really going to be able to hone in on the kind of training that our participants need. And one last thing that we feel good about, we know that in the program year, which is what we operate under for our grants, July 1 to June 30th, the program year 2019, that they had, that COVID came in the middle of all of it. And so funding, the expenditure of funds really went down in the spring. So when we start looking at March, April, May, June, of course, everyone was just still trying to figure out what was going on and how to adjust. And so we have been able to, for those grants that received an option year, they're able to take that PY19 funding and continue to expend it. And so we feel good. That's a good use of the government funds, all for the purpose of serving our homeless veterans. So we feel good about some of the changes that have happened on the grant side, and we come to the table again with the full force of the Department of Labor with employment and training. Thanks, Kathryn.
So, thank you, Maria, for that update. What I'm going to do now is ask all of the panelists to come back and turn your cameras back on. We've got some really great questions from the audience. The first one I'm going to read is from Robin Kim, and she is wondering if VHA will approve COVID testing or treatment for non-eligible veterans.
Well, I'm going to take a wild guess and think that's mine to answer.
Yes, please.
It's a great question. And just to kind of explain why that's an important question. And when you're talking about testing in congregate settings, in Grant and Per Diem, those programs can serve both eligible and non-eligible veterans. Testing just the eligible veterans does not accomplish the point of universal testing in a congregate setting. So we understand the challenge there. Unfortunately, we talked this over with our Office of General Counsel and the offices responsible for testing, and there is not, in fact, an option to test those that are not eligible for VHA healthcare without the veteran possibly incurring a bill, which we want to avoid. So right this second, there's not a solution for that. We've provided quite a bit of technical assistance or guidance to the field on ways to work around that, ways to work with county or other locality testing that's in place. But right now, we're not able to do that.
So that's interesting. And thank you for that, Keith. I've got people in the chat who I think are VA employees that are also sharing that their facility is testing both eligible and non-eligible veterans. So maybe there's something that can be done at a local level to facilitate that.
So that's interesting. And I think if a local site has developed a workaround or essentially gotten permission to proceed with that, they should. The sticking point for us was the billing. We didn't want to push something that could result in a veteran receiving a bill for something like being tested. My guess is that local sites that have figured that out may have figured out ways to work around that. Which
Gotcha.
is great.
Thank you, Keith. All right, let's see. The next question is for Norm, and it's from Deb Burkhart. She asks, will the award of COC funds on a non-competitive basis happen for sure in 2020 or just in conversations? Any opportunity for bonus awards for new deals?
So it's always hard to predict the future, especially when Congress is involved. So our goal is definitely to have a non-competitive process, but unless Congress acts, we can't really guarantee that. If there was a non-competitive process, there would likely not be an opportunity for bonus awards or new developments in this round of funding. Certainly, that's not the way we're going with the program as a whole. So we will obviously return to having sort of the normal process in future years, but that's the way we're trying to play it out this year. There's just too much going on and too much strain on communities, and they're already trying to figure out how to use billions of dollars in CARES Act resources and Treasury funds and various other resources. So that's our goal, but again, until Congress acts, we'll have to see what happens.
So that's interesting. And this is a question from me, not from any of the folks who are here in the chat, but are any of the other federal partners considering any type of a move like that where they just renew funding for the next year? And this is more of a Keith and Maria question, not to put you all on the spot.
My answer is probably a lot shorter. We still have stand down grants that are eligible as non-competitive, so that will continue. But no, any new HVRP grant is going to go through a competitive process.
I will need to take that one back and get it answered. I don't want to say the wrong thing on that. Sorry.
Okay, well, I don't want to get you in trouble. I certainly don't want that.
Grants are complicated. So.
Seeing a lot of comments in the chat, Maria, about how HVRP is a really great program, and people use it a lot to collaborate with SSVF. So, I just want to make sure that you carry that message back to your team, that our audience is really appreciative of the work that you do. We do have another question from Daniel Aponte Ramos. He says HVRP is his biggest partner, loves him, great match with SSVF. Do you have the amount of funds assigned annually to HVRP in Puerto Rico and the Virgin Islands?
If you're looking for current or active grants in those areas, nvtac.org, nvtac.org, there's a map there that will tell you where all our grantees are located, and you can find points of contact. If we don't have a specific HVRP grant in any particular area, please let me know. We can reach out to the workforce system. Even though there's not a grant there, that doesn't mean we can't bring the full support of the Department of Labor and the workforce system to support any grant, anyone working with veterans trying to find them employment.
Thank you. Let's see, we've got more questions here. This one is from Christine Cleary, and this is a comment that she had for Keith, and she says she'd like to thank the program for the flexibility on performance measures. It was extremely difficult to meet all the needs of the veterans in this pandemic while also meeting them. And so she thanks you for the shift on serving veterans rather than hitting numbers and targets during this time, because it alleviated a lot of anxiety and stress on their team's part. So thank you to you and your team for helping with that.
Our pleasure.
Let's see. One second, there are a lot of questions and I should have done this in order. I apologize, folks. My son likes to make fun of me and tell me that I have old lady eyes, and I'm feeling like he might be right as I get closer and closer to my computer monitor here. Let's see, I've got another question from Scott McKee. He'd like to know if they can get more clear and direct directives on outreach. Now is when he sees their potential clients on the streets need them most, and it seems like many agencies are hiding. After 7 months, he thinks now is the time to start moving forward and out of the shadows. So maybe this is a Keith and Norm kind of a question, but what guidance is there available for street outreach right now?
Norm, I can go first with VA
Sure.
piece of that. There's an interesting way in which our experience has mirrored what you read in the news about the federal government versus local guidance. We've had to defer to local conditions and locally set requirements. In a lot of cases, our medical centers are subject to the same guidance as other entities in communities where there's high rates of infection. So what we have done is supported homeless programs in following whatever their medical center sets in terms of face-to-face either requirements or restrictions. We're in contact with a lot of medical centers. I know of some that are absolutely itching to get out and do the face-to-face outreach, do the street outreach, go and see their Hud Bash veterans, which I know isn't part of your question, but is related, and they're not able to based on that medical center's requirements. So we're pushing any forms of face-to-face care and street outreach that can be done safely and can be done within the boundaries of local conditions, and will continue to do so. Certainly get the need for it that you're raising.
So I would just add that CDC has actually provided some guidance on safety in encampments, for example, that has some very useful information about sort of doing outreach work. I've talked to a lot of people who are doing outreach, and it's pretty clear that there's definitely a safe way to do this. It's obviously, there's a lot of stuff you have to do with protective equipment. Conversations have to be distanced, and there are other measures you need to take, but there's definitely a way to do this. And so I'd encourage people to look at the CDC guidance. If you still talk to your local public health officials, and I think both communicate the concerns about COVID spread, but also the risks to not doing outreach, right? Part of the challenge for public health officials is trying to balance different risks, right? They can't shut down things that are like life-saving necessary things, and they want to prevent COVID spread. So I think educating them about the balance of risks here is really important. But if your community still is struggling with implementing outreach, we'd really encourage you to reach out. We have some technical assistance where we can work remotely with your outreach programs to teach how to do outreach safely and provide some examples of other communities that are doing that. You can find out about our technical assistance on that same hudexchange.info. Also, if you just work with your COC, your COCs generally are pretty, they understand how to get in touch with us if you need technical assistance.
Great. Norm, can you repeat that website for everyone one more time, please?
Sure, it's hudexchange.info. I think Cindy put it in the chat window. So that's hudexchange, all one word, .info.
Thank you. Let's see, a couple more comments came up on testing, and it seems like the medical centers that were testing both eligible and non-eligible veterans were those who were testing for GPD, and Jeff Quarles chatted in that testing is in fact an eligible cost in Per Diem for grant and Per Diem. So you can use those funds for veterans who are also not eligible for VA healthcare if they're still in GPD. We've got one more question here from Charmin Alston, and I hope I said your name correctly. I'm sorry if I didn't. She'd like to know if there are any updates to offering Hudvash vouchers to non-healthcare eligible veterans, and this is for Mr. Harris. I can sort of go after you if you'd like. Keith.
Great. Yeah, I imagine we both might have pieces of this. So there's two pieces, and appreciate the question, and this is a really high priority for us in the homeless program office. There's two kind of slices to this. One is an update that Kathryn, I assume you're referring to, which is potential and pending legislation that would extend eligibility for Hudvash to OTH veterans, those that are not currently eligible. The other is something that's already in place, which is still a pretty small effort within the program called Hud Bash Continuum. And that's an arrangement where a VHA ineligible veteran can still receive the Hudvash voucher. They just don't receive the case management from the VA. And this is underway in 3 communities right now. The case management is provided by a non-VA service provider. That service provider has to be designated as such by the secretary. So there's a approval process that has to be followed. We've just recently updated all the documents about that and are slowly pushing those out more broadly. We'd like to see Hud Bash Continuum picked up in more communities. So that's sort of the service workaround, you might call it. There is legislation that is pending, and Kathryn, you probably have more current and specific information about that. Do you care to share?
I do. I was actually sitting here scrambling to find the bill number, and I can't find it in my email. So Spencer, if you're listening, please chat that into us so we can share it with the audience. There is some legislation in both the House and the Senate that would expand eligibility for the Hudvash program to veterans with other than honorable discharges. There was a big push to attach it to the National Defense Authorization Act, which stalled. So that's something that we are still fighting for, but it is still something in progress. Let's see. We got a lot of thank you so much to the panel. A lot of comments about how this group in particular are kind of the last group that remain on the by name list. We do have a question about the 3 communities that have Hud Bash Continuum. Do we know what 3 communities they are, Keith? Can you share that with the audience, please?
Yeah, it's New York City is the biggest one by far. Northampton, and I want to say Minneapolis, but I may be wrong about that. I need to double check. I have too many facts in my head. I can double check that one. Okay. But if your community, I guess I should say, if your community is interested, if you're not from a medical center, talk to your medical center. Your medical center can route that inquiry to the right place, which is through a Hud Bash regional coordinator into our office. We'd love to help more communities do it.
Gotcha. Let's see, I'm getting questions about PowerPoint presentations. And just so folks know, after the conference ends, all of the PowerPoint presentations will be loaded into the app. So that's where you will go to find them at the end of the conference, not like at the end of every day like the videos, but at the end of the conference. We'll make sure that that happens. And I did get the bill number for the Hudvash other than honorable eligibility. It is HR 2398. Thank you, Spencer, for being a lifesaver. I appreciate you. Let's see, more questions about Hud Bash Continuum, because people seem to be really engaged in this topic. So Joni Owen would like to know, how are Hud Bash Continuum programs funding the case management component?
Yeah, it's a great question because there is not VA funding for it. I probably should have said that. So the funding has to come from elsewhere, and it's typically coming from county funding, city funding. One community that's looking into this is looking at bond funding. It can also be picked up where there happens to be sufficient bandwidth within the services that are already in place, not adding new services. So it's been done a variety of ways. There's no one way to do it, but there is not VA funding for it because we're not allowed to provide that to those that are not eligible.
Well, it's interesting, Keith, that you mentioned bond funding, and you're not allowed to ask for this kind of stuff, but I am, right? So I think this is one opportunity that I will share with all of you as audience members, right? As engaged citizens and organizations that are providing services to veterans, you are fully empowered to go out there and talk to your local, state, and county legislatures and ask them for resources. Tell them you've got these big challenges. Perhaps you might be eligible for federal funding to match these services if they can pony up some money to do these kinds of things. And I think that that is something that is well within the bounds of your role as an organization serving veterans. So I'd encourage all of you to think about that. And I mean service providers, by the way, not VA employees. VA employees or federal employees, don't do that. Do not. Let's see. I've got a question from Ashley Thatcher. Would you be able to use the case management grant to cover the non-VHA eligible Hudvash veterans? I'm sorry, eligible. That's not coming out correctly today.
It's not the easiest word always to say. So theoretically, yes. What's interesting about that one is we have a variety of pilot efforts underway in Hudvash. In another talk, more time, I would have gotten more into that because there's far too many unused Hudvash vouchers. The availability of VA case management is one of the rate limiting factors. So it's something we've been working on for a long time. And one of the pilots, actually several pilots, are underway using the GPD case management grant to provide front-end case management, especially for Hudvash, so housing search, PHA work, and then early pieces of case management for veterans that are lower acuity than traditionally served by Hudvash, and so don't need that intensive suite of services that Hudvash traditionally supplies. We haven't seen a situation where they provide it to ineligible veterans, but in concept, it's the same thing. Because actually, sorry, I'm getting myself wrapped up. It's not quite the same thing because the GPD case manager is still a VA provider by extension in a way that the continuum providers aren't. If you're a VA employee, reach out to me directly. We can talk more about that one. There's some weeds that probably aren't worth getting into here, but they're close conceptually, yes.
Okay, we've got one more question from Laurie Harden, who asks if Medicaid funding can be used as case management for housing because housing equals healthcare. And maybe Norm, this is one that you might want to talk about, given all the progress that we've seen on the HUD side to do just that.
Yeah, so there are definitely communities that have been using Medicaid to provide the services in supportive housing. There are a lot of different ways they do that, but some states have applied for waivers. North Carolina comes to mind, but there are several others who have applied for waivers that create a category of Medicaid assistance that's essentially for services in permanent supportive housing. Other communities have just really looked at the standard Medicaid package and identified ways to utilize Medicaid assistance to provide those services. I'm not aware of any state that's been able to use Medicaid assistance to provide rental assistance. But for the supportive services, it is there are a lot of places that are doing this, and it's a great model. Louisiana, another example of a place that's doing that really successfully. So, you know, a lot of great examples. Strongly encourage you to work with your state Medicaid office and to do some problem solving to figure out how to make, you know, this kind of strategy work.
Perfect. Thank you, Norm. Let's see.
Kathryn, I have a brief correction to my answer about the continuum
Go
site
ahead.
that work. I was close. It's not Minneapolis, it's St. Cloud that is the third. And then actually we just, Asheville just was approved to begin this, but I don't believe has started yet.
All right, we've got another question, and this one is for Maria. It says, with the consolidation of the HVRP programs, is there any thought towards how now grantees are limited to just one grant per serviceable area where it was one per program before?
Yeah, thank you for the question. So it is, as we're getting down and providing more and more services to veterans, some of our communities have been very successful. And when we begin to put our very limited HVRP funds in 2 or 3 grants in the same community, we begin to oversaturate that community, that then grantees are competing against each other just to find a veteran to serve. So we really want to set up our grantees to be successful and not be in competition with one another in the same zip code, area code, in the same communities. And so we thought, let's take our limited funds and let's try and serve as many areas as possible. And because of that, we then allow HVRP grantees to serve incarcerated veterans, formerly incarcerated veterans, female veterans with families. All of the categories can be served under a general HVRP grant.
Got it. Thank you, Maria. Let me look at the list to see if I missed any questions. Is there anyone else in the audience? Let's see. I'm getting some nice thank yous for all the information. Getting a lot of, you know, great feedback about you all making yourselves available to provider questions, and, you know, the transparency that you all continue to show as you commit yourselves to serving veterans experiencing homelessness. What else is here? Oh, here, you know what? Here's one that I missed, and this is from Emily. I'm sorry, Emily, you asked this at the very beginning of the session. She says, SSVF has been the gateway to access CARES funding for homeless prevention, but there's quite a gap between the rules set by SSVF and the accessibility to the resources by individual grantees. Why is that the case?
Ooh, short answer is I don't know why that would be the case, and would need to check with the program office. I mean, I can tell you more generally at a policy level, the best we can do is put out the national policy and do our best to monitor, you know, the extent to which grantees pick it up and deliver. I'm sure that the program office is tracking and pushing on grantees that have not maybe adopted all the flexibilities that are available. I'm happy to take that question back to them though.
Okay. All right, and I've got one here from Jason Gilbert as well. He wants to know if there will be opportunities for new grantees to apply for GPD funding to assist the homeless population in the coming grant year.
So I'd like to take that one back. Also, to me, it's very similar to the question earlier about whether we're just rolling over non-competitively the grants or not. So, Kathryn, I'm not sure how the update process works or kind of getting back to people, but I'd like to talk to both Jeff and John and just give you a written answer on all that.
Okay, well, maybe that's something that we can sort of post in the comments under this session. Cindy, does that make sense? I'm not sure if we can do that, but I'm
sorry to interrupt,
sure
but if Jeff is still on, he could type in an answer. Jeff, I don't know if you tracked that one, but that would be a quicker way if there's not an obvious structure for providing feedback. I anxiously watch the chat box to see if Jeff is responding.
Right. Well, I tell you what, while we hold out on that, I do have one more question that I'll read and we'll come back to that, I guess. This one's from Angela Hardman, and she wants to know if you anticipate any trends post-COVID beyond what has been covered today.
Is that for all of us, do you think?
I think it's for everyone. I mean, if you all want, I can go first. And I mean, I'll tell you, I feel like post-COVID sort of feels like an illusion at this point. And so I keep talking about the post-COVID world, but not feeling confident about when exactly that'll be. I don't know if that gives you all anything to think about in terms of the way that you operate your individual programs, but maybe I'll pitch it over to the rest of the panel to share some of what they're thinking about.
We could maybe go, I'm happy to go in the same order we started with. And I spoke a little bit to this, and the answer is really an expansion of that. It's our programs have never collaborated to the degree they have now. You've got SSVF and Hudvash working together. There's just a lot of different versions of that. I anticipate we will continue that. There's been a very positive response both at our national office level, but also in the field and from veterans. So that's a big one. We've broken down, this is such an overused term, but broken down silos that existed for years and sometimes decades, and don't really intend to build those back up in a post-COVID world. And then I think you will see a de-emphasis on congregate type settings. Norm mentioned that also. The GPD Capital Grant, I think, is a big piece of that. Really trying to build better space to provide for more privacy, more isolation. Those are two right off the bat.
And I think we're going to learn a lot about disease transmission other than COVID over the next few months, right? So we have all these measures we're taking to prevent the spread of COVID. And so I think we'll learn something about what that means for flu, for TB, for other communicable diseases. I think some of the, we were on with the CDC last Friday, and one of the things they mentioned is that it appears from some of the data they're getting from countries in the southern hemisphere where flu season has already kind of happened, that the protective measures against COVID seems to have helped against the spread of flu and other things. And I think it's a lesson for us that, you know, maybe we're not doing so great even before COVID on keeping people safe and healthy. And so I think, you know, which of these measures should we just be making permanent? You know, the spacing within shelters is probably a good example. The sort of increased focus on housing and non-congregate shelter as strategies, I think those are both excellent examples as well. And then I think the work on racial equity has sort of bubbled up at the same time as COVID. I think been highlighted by COVID. And I think that was going on prior to COVID, but I think it's gotten a bit of a jump start or a boost during COVID. And I think that is something that I expect to continue and accelerate after COVID is over.
Maria?
Yeah, and at Labor, I would echo that, you know, partnerships, collaboration is going to strengthen. And for us, we're hoping that our grantees take a look of outside the veteran community, that there are plenty of other providers and partners that we need to reach out to. From an employment standpoint, it is going to be incumbent upon us to work with the training providers. Right now, everyone's just, you know, thinking the way training was provided, it would be in a classroom, and you go and you learn with a bunch of other people who are learning in that classroom. And I think we're seeing the changes in higher education and secondary education. So the same thing is going to have to happen with career technical training and other training opportunities. So working with the training providers and then working with the employers, because they're the ones that are really going to set the landscape for what does a typical day at the job look like? What does, did this open up a whole new stream of opportunities for different types of careers? And so that's what we'll be doing and focusing in on at Labor.
Got it. All right. So Jeff chatted in while you all were doing this, coming back around to GPD. And he said that next year there will not be any openings for new grants, but it'll be an option year for existing grants. This year was the year for new transitional housing grants. So I'm sorry. Try again next time. I've got two more big questions, and I think the first is pretty quick, and it's probably a Norm question. What do you expect when the eviction moratoria expires, and maybe when will it expire?
Well, I don't think I know anything that other people don't know just from following the news. So I think there's a huge question mark as to what happens when the eviction moratorium expires. A lot of that depends on what resources Congress makes available between now and then, if any. So I think that's still a very, very big open question. And unfortunately, I don't really know the answer. We have been tracking a lot of different metrics to try and get an understanding of whether and to what degree we'll see a surge in evictions and how many of those will lead to homelessness. It's really hard to tell. So much of the data just is contradictory right now because of just because COVID has really sort of created this shuffling of how everything is supposed to work. So the short answer is I just don't know. I suspect it's going to be a giant problem, and we're going to have to see what resources get applied and whether the eviction moratorium just sort of ends or whether there's sort of a ramp down. So all to come, I suppose.
Okay.
Kathryn, can I add one thing to that?
Yep, of course.
And this is, we of course don't know either, but it's a big topic of conversation within SSVF, which of course is our primary prevention program. It's one of the big reasons we've really aggressively sought the CARES funding that was given to VA and gotten a very large chunk of that for SSVF. And it's why SSVF has lifted its typical cap on prevention relative to rapid rehousing. So we're trying to make a really quite large bolus of money available and ready for this when we do start to get a better sense of what the need is and where it is. So that's one way we're preparing for it, even though we can't predict the future any better than what Norm described.
Gotcha. All right, so I've got one last question, and I know we're running pretty close to time. And this is from La Quinta Tibbs. I hope I said your name correctly. I'm sorry if I didn't. She says she would like to know more about how each office and program are truly addressing racial disparities.
Well, I'm happy to say a quick thing about that. And for us, where it has started is in data and monitoring the flow of veterans into our programs and out of our programs and the outcomes for them, because we want to make sure we understand the conditions and what we're facing. And just, I know we're out of time, but Kathryn, I want to say just really quickly the results of our national analysis we've done on that. And what we looked at were base rates of the different racial groups, and then the rates at which those groups enter our programs, because we wanted to make sure that the movement into our programs at least matched the population rates. And in fact, it does. In fact, veterans of color actually enter our programs at a slightly higher rate than their percentage of homelessness nationally. We also looked at outcomes. We wanted to make sure that the exits to permanent housing were essentially equitable. And in fact, the rates of exits to permanent housing for veterans of color exceed the rates of entry and the rates in the population. So as of right now at a national level, we feel very good about what that is telling us. Our programs are both accessible and effective for veterans of color. We have gathered data by community and by medical center and continue to look at that. That's some really complicated data sets, but that's a big part of our work right now, is just understanding what we're seeing, and then we plan to go from there.
So Keith, I think really sort of pointed out an important sort of starting point for a lot of these conversations is really grounding them in data. In addition, we've put out a lot of, in our technical assistance material, we've tried to ingrain racial equity concepts throughout our guidance to communities about how to implement CARES Act funding. and how to implement COVID responses. Again, if people go to that hudexchange.info link, they'll find we actually have a lot of hopefully concrete and practical suggestions for communities for implementing racial equity principles, including, as I mentioned before, identifying organizations for funding that have expertise in promoting racial equity, things like tracking outcomes, in sort of identifying strategies for targeting communities that have historically been underrepresented in homeless assistance interventions. So there are a lot of things there, and I will say we're trying to like focus on all the little things you have to do. It's not just sort of one fix for everything. We really need to just sort of dig in and in every step in the process, identify steps we can take to promote racial equity. So again, a lot of that's on the website, but I will also say we are very, very open to suggestions and recommendations. We don't know everything, and we're very interested in hearing suggestions from people. So thanks.
And I'll pick it up right where where Norm left off in being open to suggestions and ideas. At Labor, at Vets in particular, we just got approval from OMB to collect certain pieces of data that we didn't collect before. So that's just now been given us. And we actually found that it probably isn't even enough data. It isn't, it doesn't categorize the different, the multitude of veterans that are coming into our program. So we may have to go back and be sure that we are able to request the data so that we can collect it and then of course take a look at it. Also with our veterans technical assistance, we also are going to be working towards how can we improve the technical assistance that's being provided, or any of the standard documents or requirements. The way that we do business are the things that we're going to be looking at through our technical assistance folks.
Okay, thank you. So we are at time, but panelists, do you want to have a minute or two for last words before I close it out? I want to be sensitive to your time because I know you're all busy and you all are off doing the Lord's work. But if any of you has anything that you want to share that you didn't share in 1 or 2 minutes, I will give you the opportunity to do so.
I think I've said everything I planned to.
Okay.
I just want to say thank you to everyone who's working in homeless assistance right now. Like, I'm just continually amazed at the work that everyone's doing and how they've just risen to the challenge here. I know, personally, for a lot of people, there are a lot of challenges just with, everyday life, and the amount of dedication people have put into their homelessness work has just been incredible, and it's really inspiring. So just want to say a word of thanks to everyone out there who's continuing to do this great work.
Yeah, absolutely. I think Norm said it well, and we'll end on his words.
All right. Well, in that case, I'd like to thank the three of you for coming and joining us virtually. I know this is very different than our normal format, but it is really nice to see all of you from wherever you are in the country. And, I appreciate your time and your expertise. I'm going to close out. I've got literally just thank yous left. So here's where I leave you. I hope for all of you, this is the last time you have to see my face during this conference. I'm sure you all hope that too, since this is the second plenary we've got. We've got some really great workshops this week focusing on local innovations, really interesting things that folks in the community and across the nation are doing. We've also got some really great workshops on key populations needing additional focus. I hope you all have a wonderful conference and that you've enjoyed it. If you did, I hope that you all will take a really great opportunity to thank the NCHV team. It was no easy task winding down what was a giant in-person conference and shifting it and re-envisioning it to become this virtual event for you. So I'm gonna read their names, and if you see them in the chat, in the app, in the wherever, go and send them your love. Okay, so thank Cindy Borden, thank David Higgins, thank Jasmine Basley, thank Karen Christian, thank Spencer Bell, thank Asia Christian, all of them for pulling together. Please also thank some of our other support staff that come together around just the conference. So Fred, Sky, David, Caroline, Justin, all of you that pulled together around comms, around video production for our first plenary, around just event production in general. Thank you for helping us make that a reality. Our board of directors and our founders, thank you for your support, your insights, your wise words, your wisdom as we planned and executed this event. And thank you to our speakers like the three of you, and like everyone who took the time to speak during this 2-week event. Last but not least, well, not last but not least, I'm going to thank our sponsors, and then I've got a last but not least after that. I'm sorry, people. So the Home Depot Foundation, Citi, the National Equity Fund, Technical Assistance Collaborative, the American GI Forum National Veterans Outreach Program, the Washington State Department of Veterans Affairs, and the Spokane City Regional Veterans Service Center, STOP Inc., VOA Mid-States, ABCCM, BVSJ, VVSD, Services for the Underserved, Jericho Project, Brian Cave Layton Paisner, and the Virginia Beach Community Development Corporation. Thank you for sponsoring this event and helping us put this on. We couldn't make it happen without you, so we appreciate your partnership. But last but not least, thank you to the 795 of you who registered for this event and came to join us. We were not anticipating that so many of you would come. We're thankful that you're here, and we hope that you'll join us next year, maybe in person if it's safe, maybe if not via the computer again. We'll have to see. But I'm so thankful for the time that you've spent with us last week and this week, and for all that you do in your community. I appreciate you, and I guess, come back tomorrow for a workshop. It's something fun. I'll see ya. Thanks, guys.